Welcome to today's lecture on Dent disease. This is a rare genetic disorder that affects the kidneys and has various renal manifestations. We will explore its genetics, clinical features, diagnosis, management, and long-term outcomes. Let's begin our journey into Dent disease. Dent disease arises from CLCN5 gene mutations affecting CLC5 function in kidneys. This hampers endocytosis and protein reabsorption in proximal tubules, leading to low molecular weight proteinuria, hypercalciuria, and nephrocalcinosis. We examine how these mutations impact vesicular acidification and protein transporter recycling in renal tubules. Dent disease can also result from OCRL gene mutations, disrupting intracellular trafficking and signaling pathways. These mutations impact phosphatidylainositol 4,5 bisphosphate metabolism, affecting endocytic processes and receptor recycling in the proximal tubules. The specific mechanisms and clinical implications of OCRL gene mutations in Dent disease will be discussed. In Dent disease, the impaired function of the proximal tubules in the kidneys results in the abnormal handling of proteins, leading to their loss in urine. We will investigate the detailed mechanisms behind this dysfunction and its impact on Dent disease. Dent disease presents with a diverse range of clinical features that primarily affect the renal system. Common manifestations include low molecular weight proteinuria, hypercalciuria, nephrocalcinosis, and renal insufficiency. Additionally, patients may exhibit features such as hematuria, renal stones, renal magnesium wasting, and rickets. We will closely examine these clinical features and discuss the specific diagnostic criteria used to establish a diagnosis of Dent disease. This will include a thorough analysis of laboratory tests, imaging modalities, and genetic testing techniques that aid in differential diagnosis and confirmatory testing. Proteinuria is a hallmark feature of Dent disease and has significant implications for the renal function of affected individuals. We will explore the underlying mechanisms that contribute to proteinuria in Dent disease, including the disruption of receptor-mediated endocytosis and the subsequent loss of low molecular weight proteins in the urine. We will discuss the clinical significance of proteinuria in Dent disease, including its association with renal dysfunction, progression of renal disease, and potential therapeutic targets for management. Hypercalciuria, the excretion of excessive calcium in the urine, is a common feature in Dent disease. We will delve into the evaluation of hypercalciuria in Dent disease patients, including the assessment of renal calcium handling, serum calcium levels, and the risk of renal calcifications. Furthermore, we will discuss the management strategies employed to address hypercalciuria in Dent disease, with a particular focus on thiazide diuretics and their role in reducing renal calcium excretion and preventing nephrocalcinosis. Nephrocalcinosis, the deposition of calcium salts within the renal parenchyma, is a significant complication of Dent disease. We will explore the pathogenesis of nephrocalcinosis in Dent disease, highlighting the role of impaired calcium reabsorption in the proximal tubules and altered urinary pH levels. Furthermore, we will discuss the clinical consequences of nephrocalcinosis, including the impact on renal function, the risk of renal calculi formation, and potential management strategies aimed at preventing its progression. Renal biopsy findings can provide valuable insights into the underlying pathology and guide the diagnosis and management of Dent disease. We will discuss the characteristic histological features seen in renal biopsies of Dent disease patients, including the presence of tubular vesicles, microcystic dilation, interstitial fibrosis, and medullary sponge kidney. By understanding the distinct renal histopathology observed in Dent disease, clinicians can make accurate diagnoses and develop targeted treatment plans for affected individuals. In this section, we will discuss the current treatment strategies for Dent disease, which include dietary modifications, supplementation, and medications like thiazide diuretics and angiotensin-converting enzyme inhibitors. We will also explore future directions such as enzyme replacement therapy and gene therapy. Assessing the long-term renal outcomes in Dent disease is of utmost importance in the management of affected individuals. We will examine the various predictors that influence the progression of renal disease in Dent disease patients, including the severity of proteinuria, the degree of hypercalciuria, and the presence of nephrocalcinosis. Furthermore, we will discuss appropriate monitoring strategies, including regular renal function assessments, urinary protein measurements, renal imaging studies, and genetic counseling, to ensure early detection of complications and timely intervention. Dent disease predominantly affects males due to its X-linked inheritance pattern. However, there have been rare instances of Dent disease manifesting in females. We will explore these exceptional cases and the challenges they pose in terms of diagnosis and management. The presence of Dent disease in females raises questions about the genetic mechanisms underlying its phenotypic expression and the potential role of X chromosome in activation. By delving into these complexities, we can gain a deeper understanding of the pathogenesis and clinical implications of Dent disease in the female population. Dent disease not only affects the renal system but also has implications for the urinary system as a whole. We will examine the impact of dent disease on various urologic aspects, including the urinary tract, bladder function, and the risk of renal stone formation. Moreover, we will discuss the urologic considerations that need to be taken into account when managing patients with dent disease, ranging from preventive measures to address urinary stasis to the evaluation of bladder dysfunction and the prevention of recurrent urinary tract infections. In conclusion, dent disease is a rare genetic disorder affecting kidney function. This video has provided a detailed understanding of its causes, symptoms, diagnosis, and treatment options. Further research in this field will benefit patients and advance nephrology. Thank you for watching.